If you want to know how intensive care at home can take the pressure off intensive care units and emergency departments, stay tuned. I've got news for you. My name is Patrik Hutzel from intensivecareathome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies at home, and where we also provide tailor-made solutions for hospitals and intensive care units at home, whilst providing quality care for long-term ventilated adults and children with tracheostomies at home. Otherwise, medically complex clients, adults and children at home, which includes home BIPAP, home CPAP, home tracheostomy care for adults and children that are not ventilated, home TPN, home IV potassium infusions, home IV magnesium infusions, and home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, which also includes palliative care at home. We have also sent our critical care nurses into the home for emergency department bypass services for the Western Sydney Local Area Health District, the InTouch program. And today I actually want to focus a little bit more on emergency departments. Yesterday, on the 12th of July, 2024, there was an article in The Age, which is a Melbourne-based online and print newspaper. And the journalist Tony Wright published an article about a day and an unexpected night in the emergency ward, and he describes what the busiest emergency department in Victoria looks like, which is at the Northern Hospital. So some takeaways from this article, and I link towards the article, and thank you, Tony, for publishing the article. I think it's very insightful. Just some figures and numbers to illustrate what's going on in an emergency department, the flow-on effect into ICU, and then also how our service, intensive care at home, can help not only intensive care units, but can also help emergency department services and also help patients and families to experience healthcare episodes at home rather than going into an already frantic emergency department, which has no ICU beds, but that comes in a minute when I go through the article. So some key takeaways from the article. Apparently, the Northern Health Emergency Department experiences 120,000 presentations per year. That's around 330 presentations in a 24-hour period. And according to the article, up to 400 presentations in a day. Apparently, it's flooded with 93 to 126 ambulances every day. And according to the article, there are many days where there are no ICU beds, and some patients in ED obviously need to be triaged to intensive care, right? Especially when they're going through the resus area, where they might need resuscitation, such as CPR, inotropes, ventilation, and so forth, right? They all end up in ICU if they get there. And there are many days where there are no ICU beds, and some patients in ICU we can take home with intensive care at home, especially long-term ventilated adults and children. But I'll come to that in a while in more detail. Apparently, the Northern Health Hospital also set up a virtual ED, a statewide service, free service, which gets up to 1,000 presentations a day, right? So we are now up to nearly 1,400 presentations a day, either in person at the emergency department or virtual via the virtual ED, which is a great service, by the way. I mean, we're all about keeping people out of hospital. I think we're well aligned there. I mean, that's the whole philosophy of intensive care at home, keeping medically complex, high acuity patients out of the hospital system, which is already at breaking point. Now, also, according to the article, since the beginning of winter, the whole Northern Hospital has been on code surge, which is basically means, you know, other doctors and nurses within the hospital are constantly on alert to drop everything they do to spend their time and resources in the emergency department to help with an already overcrowded emergency department when there are no ICU beds available in the hospital. So you can almost say that the whole ED and hospital has been in crisis mode since the beginning of this winter, which here in Australia is on the 1st of June. Now, let's break this down further into urgency and timeliness that descends through a series of categories laid out in guidelines of the Australasian College for Emergency Medicine and assessed by the ED's triage specialists, and once again, how intensive care at home can help. So the system ensures that someone with suffering a life-threatening crisis, such as major heart attack or respiratory arrest, category 1 emergency, gets immediate treatment. Fair enough, that makes a lot of sense. And by the way, I have worked in critical care for nearly 25 years in 3 different countries myself. So I'm well aware of category systems, but I'm just explaining it here, in more detail for everyone to understand where intensive care at home fits in and how we can help. Next, a patient suffering severe respiratory distress, chest pain of likely cardiac nature or acute stroke, right through to severe trauma is judged to be a category 2. Imminently life-threatening, requiring treatment in 10 minutes. Category 3 is assigned to those suffering potentially life-threatening conditions moderately, severe blood loss, moderate pain, persistent vomiting, or a child considered at risk of abuse and should be seen within 30 minutes. Category 4 is classified non-urgent and might include vomiting without dehydration, pain or difficulty swallowing, without respiratory distress or a sprained ankle. This group can hope to be seen in an hour. Category 5 is for the quote-unquote less urgent, experiencing minimal pain, minor symptoms of existing stable illnesses and small cuts, not requiring stitches and the like. So within those categories, definitely category 4 and 5 can be treated at home. What the categories actually don't mention, but which is something we have done in the past and currently for some of our clients, including, again, the Western Sydney Local Area Health District, the InTouch services, tracheostomy tube changes or looking or troubleshooting tracheostomies in the community, PICC tube changes, IDC indwelling catheter changes or unblockages, or SPC suprapubic catheter changes or unblockages. The same again with PICC tubes. Could be a change, it could be unblocking them, or the same with the nasogastric tube, it's unblocking them or changing them. That can all be done in the community. We've also changed casts and splints in the community to avoid readmissions to ED. I mean, everyone that's been to a busy emergency department or emergency room knows it's like a war zone, right? And you don't want to expose anyone in their right mind to that war zone, for lack of a better term, if you can treat it at home. Also, especially with residential aged care facilities, also taking on more and more higher acuity clients and patients and residents, there's also a need for an emergency bypass service for aged care facilities, which is something we have done as well. Again, especially when it comes to PICC tubes, nasogastric tubes, tracheostomies, IDC, SPC, it can all be done in the comfort of someone's own home or own residence. No need to go to ED by having our critical care nurses coming into someone's home. I hope that gives you an understanding on where we fit in, especially once again, it's clearly documented in the article that there are no ICU beds, and there would be patients in ICU at the Northern Hospital and in any other hospital for that matter in ICU that are there for long-term ventilation with tracheostomy, and that can absolutely be done at home. There's no question about that. We've been delivering hundreds of thousands of hours of intensive care at home since 2012 here in Australia. The model is well proven. The concept is well proven that we keep long-term intensive care patients at home predictably. So now, if you are an ICU specialist, ICU consultant, ED specialist, ED consultant, or a hospital executive watching this, now you know where we fit in, and now you know how we can help you. Or you might even be a family watching this and you think, oh, my mom, my dad has, some of the conditions that are laid out here. Well, maybe we call intensive care at home and can treat my mom, my dad, my family member at home instead of going to a busy ED. Makes perfect sense. And like I said, we have been providing emergency department bypass services, sending our critical care nurses into the home for the Western Sydney Local Area Health District, the InTouch program. Now, With Intensive Care at Home, we are currently operating all around Australia in all major capital cities, as well as in regional and rural areas. We are an NDIS accredited service provider, TAC in Victoria, as well as WorkSafe in Victoria, iCare in New South Wales, NIISQ in Queensland. We are also a DVA approved service provider all around Australia. Our clients have received funding through public hospitals, private health funds, as well as departments of health. And talking about accreditation, we are NDIS accredited, but we are also accredited for ACIS, for the Australian Community Industry Standards. We are the only service within Australia that has achieved third-party accreditation for intensive care at home nursing services. There's no other organization in the country in 2024 that has achieved the same level of accreditation than we do. We are also providing level 2 and level 3 NDIS support coordination, which is critical for most NDIS participants. If you are at home already, maybe in similar situations, and you don't have enough support, you don't have enough help, your family member or yourself is going back to hospital all the time, please know that there's help at hand. Or if you're in ICU watching this and you have patients coming back all the time because they can't be kept at home predictably, and the patients don't want to be in your ICU. You don't want to have those patients in your ICU because you have other patients that you need to look after. We want to hear from you because we can help you keep those patients home predictably. So if you're at home already, please reach out to us at intensivecareathome.com. Send us an email to info@intensivecareathome.com or call us on one of the numbers on the top of our website. Now, if you're an NDIS support coordinator and you're looking for nursing care for your participants, please reach out to us as well. If you're looking for funding for more nursing care, I also encourage you to reach out to us. We can help you with the advocacy, and we also provide specialist NDIS nursing assessments. Also, if you are a critical care nurse and you're looking for a career change, we're currently offering jobs for critical care nurses in the home in Melbourne, Sydney, Brisbane, in Albury, Wodonga, Bendigo, Victoria, as well as in Warragul, Victoria. If you have worked in critical care for a minimum of 2 years, ICU, pediatric ICU, ED, and you have ideally completed a postgraduate critical care qualification, we want to hear from you. We are offering a tailor-made solution to our clients, which includes regular staff. Our clients want to have the same staff coming over and over again because they are so vulnerable, and it's all about relationship building and having regular and stable teams. So if you are looking for agency work where you can come and go, this may not be the right fit for you. But if you are interested in a long-term engagement with us and long-term engagement with our clients and building those crucial relationships, then this is a win-win situation for everyone. And if you're an intensive care specialist or ED specialist, we also want to hear from you. We are currently expanding our medical team. And once again, if you're an intensive care specialist, ICU consultant, ED consultant, and you have bed blocks in your ICU or ED, we want to hear from you because we can help you take the pressure off your hospitals, and in most cases, you won't even pay for it. And once again, if you're a hospital executive, you have bed blocks in ICU, ED, respiratory wards, please reach out to us. And lastly, if you're in the US or in the UK and you're watching this, we want to hear from you as well. We can help you there privately. Once again, all of that you get at intensivecareathome.com. Call us on one of the numbers on the top of our website or send us an email to info@intensivecareathome.com. If you like my videos, subscribe to my YouTube channel for regular updates for intensive care at home and for families in intensive care. Click the like button, click the notification bell, share the video with your friends and families. Comment below what you want to see next, what questions and insights you have. I also do a weekly YouTube live where I answer your questions live on a show. And you will get notification if you're a subscriber to my YouTube channel or a subscriber to our email newsletter at intensivecareathome.com. Thank you so much for watching. This is Patrik Hutzel from intensivecareathome.com, and I will talk to you in a few days. Take care for now.